Okay, so I think since the other batch, the complete students will not come, we will not know how many of them will be coming, right? So I think we can start the class today. So this subject is rehabilitation medicine. So if I'm not clear or if there is any problem in the internet, just stop me. Okay. So this rehabilitation medicine, if you see, this is the overall subject, whatever you have learned so far. So whatever you have learned so far means like this is applying all the techniques whichever you have learned in all the different aspects, that is like musculoskeletal, cardio, neuro, like all the aspects. Like this will cover all the aspects of all of the subjects. Is that clear? See, somebody please answer.
Yes, miss.
Okay. It seems like I'm just talking, it's like a one-way process. So this is like it is not in this particular subject. You cannot say that only musculoskeletal will come, neuro or only cardio. So all the aspects will be covered in this particular subject. So rehabilitation means you are completely covering up the particular person. So that is called as rehabilitation, rehabilitating. Okay, so first we will see like what are the topics you will be covering here. Then we will see the assessment pattern. Then we will go into today's chapter. So we will be having nearly 10 topics to be covered. So the one is the today is introduction class. Then we will see what are the teams that is involved in rehabilitation. Then we will see how this rehabilitation unit is set up, because we can include this in case if you are planning to start a clinic setup, then you can include this particular rehabilitation unit. Then what are the equipments that can be used for rehabilitating a particular person? Then how we evaluate the disability? Then what are the architectural barriers? Then how we need to improve the aerial activities? So these are the topics we will be covering in this particular subject. So this subject is 2 credit paper and it will be for 80 marks. So your midsem will be for 50 marks and your final will be for 80 marks. So along with your midsem and final, you will also have a assignment. So most probably I will upload the assignment by next week. So you will have time, like at least like some 4 or 5 weeks time you will be having. Then you can submit the assignment. Is that clear? So this is about the overall of a subject. So in the LMS, I will upload the syllabus. I will upload the teaching schedule. So what are the topics we will be covering in first week, second week, like that. So I will upload that, and I have one ebook for this particular subject. So I will upload that particular ebook also. So I strongly recommend you to read the book and keep the slides as a guidance. Don't just read the slides alone. So you please read the book. It's a very small book only. So you can just read the book. The all the like slides you can keep it as a guideline. Is it okay? So now we will enter into the topic. So today we will see about the introduction. So today we will see what is rehabilitation and what are the team members who are involved in this rehabilitation. Exactly. So that is what we are going to see today. So rehabilitation is a Latin word. So rehab is a Latin word which means re means again and habit means make fit. Or you can, in other words, you can also say habit is uh, the the function which you do unknowingly by yourself. That is called habit. So we say he has a habit to do that. So that means like habitually, knowingly or unknowingly, that particular person will be keep on doing that particular movement or a function. So that is called habit. So this is a Latin word which means as making a person to be fit again. So making a person to be fit again means we will be restoring his previous abilities, or in other words we can say we will be able to restore all his previous function. So that is called rehabilitation. Okay, so this is an act of restoring physical, mental, and cognitive abilities that have been lost due to a disease or an injury. So it can be because of an injury or because of a disease, the particular person's ability to do a function or a particular person's ability to do a cognitive skill might be affected. As a as a rehabilitation member, we need to help them to regain all the affected ones. So you have to keep in mind, we are not going to bring anything new. We are going to bring whichever is already present in the particular person. Okay, so that is called as rehabilitation. Oh, okay, that is called as restoring. So, according to WHO, rehabilitation means a set of measurements that assist individuals who experience or likely to experience disability to achieve and maintain an optimal function. So that means it is a rehabilitation is a measure, or you can also say it is a technique to help the individual to regain the affected function, or to help them to prevent to lose the particular function. Is that clear? So that is called rehabilitation according to WHO. So this rehabilitation will help the individual to return to his original ability, or to return to his near normal original ability. So most of the time, because of the disease or injury, sometimes we may not be able to regain his original functions. So in that aspects, we will be able to help them to regain to a near normal life. Near normal life means to closer to his original life, we will be able to bring back to them. So that is the rehabilitation. So what are the goals of this rehabilitation means? We help the person to understand what is their problem and how their body is functioning. Okay, so we need to teach the particular person what is the disease, like how the disease have affected the particular person's body, and because of that affected one, how the body is functioning little differently. Okay, so that is one point. Second point is to maintain the high level of health that avoids secondary complication. So to help them to maintain the near normal life, so that they are able to prevent the complications. Okay, so prevent the complications in sense they will be able to help the prevent the secondary complications. Okay, just a minute. Hello. ஆக்சுவலி நான் இப்போ கிளாஸ்ல இருக்கேன். கிளாஸ் முடிச்சுட்டு நான் வந்துடுறேன். ஓகே. இங்க தான் ஆஃபீஸ்ல தான் கிளாஸ் எடுத்துட்டு இருக்கேன். அத முடிச்சுட்டு நான் வந்துடுறேன். ஒண்ணும் பிரச்சனை இல்ல. ஓகே. So, first thing is we will help them to learn about their problems because of the disease, how the body is affected. The second one is we will help them to avoid the secondary complications due to the problem. Third is to to make them, or to make them to help them to come back to the society. So before the particular accident or before the particular disease, he must be, that particular person may be little bit active in the society. Later on, because of the disease, he should not sit in the wheelchair alone. So we make them to come back to the his own community. Okay, so that is the goals of this rehabilitation. Okay, so hello, ஒரு நிமிஷம் இருங்க, ஒரு நிமிஷம். ஓகே, நான் பேசிக்கிறேன். Student, just a moment, okay? I'm so sorry. Yeah, I'm so sorry for the disturbance. I hope you understood the goals of the rehabilitation. Now we will go into the aims. So goals are what we are going to achieve. Aims are how we are going to achieve the particular objective. Okay, so aims means how we are going to achieve the particular objective. So first is like we will try to prevent the loss of a function. For example, we can just take a stroke patient. So the stroke patient is coming to the department for the rehabilitation. So our first aim will be to prevent the deformities or to prevent the loss of function. So deformity, you can just say, take an example as foot drop. So if a person has a stroke, first we will see and we will try to prevent foot drop, because foot drop is the first and foremost deformity that can affect the stroke patient. So we prevent that. So that is our first aim. Second is certain deformities we may not be able to prevent it. So we may able to slow down the deformity. Is that clear? So certain problems are there. If the particular patient has that problem, it will definitely end up in that deformity. But as a PT, we may able to delay the process of losing the function. Okay, so that is our second aim. Third is we will try to improve or restore the function. So whatever the function or mobility that is affected, that one we will try to improve it. So that is our third aim. Fourth one is, if at all, if we are not able to uh, prevent the problem, if at all, if we are not able to prevent the deformity, we give them some compensation so that they are able to do the particular activity. For example, if the person is having stroke and you try to prevent foot drop, but you were not able to prevent foot drop, the person had foot drop, then we compensate it. So we give them some splint and we help them to compensate the loss, and we help them to do the particular function. Okay, so that is our fourth aim. Then fifth aim is to maintain the current function. So some people will be coming where we will not be able to do any improvement, where we will not be able to restore the movement, but we can at least maintain the particular function. So in those people, we will be able to maintain the function. So this is the aim. So overall, the rehabilitation aim is to prevent. If we are not able to prevent, at least slow down the process. And if the particular deformity has come, then you give them compensation. If you are able to improve, you improve and restore the function. If not able to improve, then at least maintain the function. So this is the aim of rehabilitation. Next. So next we will see what this WHO has recommended. So initially at the early times, this rehabilitation was not included in the health system. So this rehabilitation came in the later time only. Okay, so maybe like after your 1980s only, this rehabilitation word or framework has come into the health system. So previously, we didn't have the rehabilitation in our health system. So if a person is affected, he will be seeing the doctors. The doctor will be giving the treatment. Then, if needed, they will be referring to the physiotherapist. The physiotherapist will see them and just send them back. So after the person is going back home, we don't know what is happening to the person. We don't know whether he's able to run his normal life. We don't know whether he's able to go back his original job. So all that later part of a health system was not there. So WHO made a framework to strengthen this health system. So that's why it developed this rehabilitation. So this rehabilitation was mainly focused in lower and middle income countries, because developed countries will have a lot of other aspects, and they will be taking care of the affected persons with a lot of compensation of money or in other ways. So but in the lower and the middle income countries only, this disabled person will be affected more. For example, a father in a family has met with an accident and he has lost his hand. So because of that, he may not be able to do his regular work. So that means the whole breadwinning of the family is affected and the whole income of the family is affected. So later the health system did not, previously they did not bother about how the family will run or how the family father will be able to go back to his work. All these aspects were not at all considered. But because of WHO, we started to consider all these things, and the lower and the middle income countries started to look or help this disabled person. Okay, so we will see what are the recommendations given by WHO. What are the recommendations to include this rehabilitation in the health system? The first thing is definitely all the big centers need to include this rehabilitation service. So that's how our physiotherapy, occupational therapy, every department came into existence with the hospital. So they strictly said that all the hospitals should have this rehabilitation services. And not only that, the rehabilitation should not be only in the hospital. It has to be in all the three levels of the community. That is primary level, secondary level, and the tertiary level of the community. Okay. So that means within the hospital, the patient should not be seen only in the hospital, but also he has to seen in all the levels of the community system. Then only we will be able to improve his uh, life. Then third is, this rehabilitation is like a working team and it has to work in a multidisciplinary level. It is not only stick to a single level, it has to be in a multidisciplinary level. So as I said early, it is not only musculoskeletal, it is not only neuro, it is not only cardio. So it includes all the disciplinaries. Some people, because of the cardiac problem, also will have disability. Okay, so that's why we have to include all the multidisciplinary in the rehabilitation workforce. Then fourth one is the the rehabilitation should be available both in the community and the hospital setup. So for example, a person is having neuro problem, and you are trying to improve him, but you are not able to improve his mobility. So the person will be in wheelchair for some time, maybe for 2 months or 3 months. Till he is improving, the person need to be in the wheelchair. So in that aspect, you give him training how to use this wheelchair and how to turn in the wheelchair, how to move in the wheelchair, all those things you give them training. But afterwards, you just leave him means after going back home, if the particular person is living in first floor and he doesn't have lift, how he will go back to his home? He may not be able to go back to his home. So that's why this rehabilitation service need to be extended till the community. So you need to see if I'm getting if I'm discharging this particular person today, whether he will be able to use or utilize all these services in his home, or how he is going to utilize this in his home. So what are the modifications we have to do? So before discharging itself, you have to ask the person, like where is your house, whether it is in the first floor or it is in the ground floor, whether you have, whether you will be able to enter with the wheelchair, whether the doors are widened, whether the doors are very narrow or shorter. All those aspects you have to think. So that is the community level rehabilitation. Okay, so in case if you're not able to look after that, then you have to refer to the community rehabilitation centers, where they will give the further training and they will ask them to do the modifications at home, and they will work on it. Okay, then next. So next recommendation is you need to have a specialized unit for this rehabilitation, especially for people who are having complex needs. So some people might have a very complex problem. So for those problems, you need to have the particular setup. So maybe like not all the hospitals will have all the setup, but some hospitals will be having the extended setups, like for people who are having a hand problem. So how to rehabilitate his hand. So for that particular hand, improving hand function, they will have lot of equipments. So those are the complex needs. Okay, then sixth is what are the financial resources that can be allocated to the particular person. So not you don't rehabilitate only the physical aspect of the person. You have to look after the financial aspect of the person. Okay, so that means like you have to see how whether the person is eligible to get any government funds, whether the person is eligible to get any other funds from any other sponsors or anything like that. So all these aspects also you need to see. Then the last is we need to see how much the health insurance will be covering. So how much the health insurance may be covering may not be suitable for Malaysian kind of setup, but this will be suiting more for the European countries or Western countries. So they will see how much the health insurance will be covering to this particular person. So how long, maybe how many months or how many years the health insurance will be covering. So all those aspects also will be seen. Okay. So you don't think like how as a physiotherapist we will be able to look after all these aspects. So we are not going to do this as an individual. We are going to do this as a team. So in the rehabilitation team, if you see all the people will be included. Okay. So we will see those people later. Now, so before going into the team, so we will see certain terminologies. So this, you might have known all these terminologies. So what is health means? Anybody can say what is health? Maybe you can explain in your own words what is health. Talk something.
Free from disease mentally and physically.
Okay. So it is like it is not only free from disease, it is also a complete well-being of physical and mental. Okay. So yes, previously they were seeing health as only physical and mental. Okay, so in the beginning, they were saying health means it is only physical. If a person, when they are seeing physically, if they are fit, they say they are fit. But later on, they included the mental well-being also. So the person need to be fit physical, and he should be able to think or do all the cognitive aspects also. Okay, nowadays we also include the third part that is called social well-being. So, social well being means how the person is able to mingle in the society, how the person is talking to the other person. Okay. So, you can just imagine if any one of your batchmate is not at all talking to anybody, then what you say about that particular student? We say him like introvert, right? So if a particular person is not mingling with anybody else, then also we say, oh, he has some problem lah. I think he's not mentally fit. That's why he's not talking to others, isn't it? So we talk so much about them. So that's why this health means it is not only physical. We include mental as well as the social well-being. Okay, so if a person is fit in all these three aspects, then only we say the particular person is healthy. If he has any social problem, then we have to refer him to a particular rehabilitation team member who will be taking care of his social well-being. Is that clear? Then next, what is disease? So disease is nothing but some abnormality, maybe in the body structure or maybe in the body function. Okay, so disease means some abnormality in the body structure or in the body function. Then third is like impairment. Impairment means any loss or abnormality of psychological, physiological, and anatomical structure or function. So here, if you see, like first, health is a common term. So disease means something that is affecting a particular body function or something that is affecting a person, and because of the particular disease, he may lose his physical fitness or he may lose his mental fitness or he may lose his social fitness. Okay. Then most common terms that are used in the, rehabilitation is impairment, disability, and handicap. So impairment is any loss of any particular aspect. So the loss of a hand, loss of a finger, loss of a mental ability to decide, loss of mental uh, what you can say, like loss of ability to read, loss of ability to study. So all these also will come under impairment. Is that clear? I hope you understand the the you understand the difference. So loss of a particular physical structure like hand, leg, fingers, toes, nose, like that, or loss of a psychological aspects like the person's ability to decide, the person's ability to read, the person's ability to learn, the person's ability to think and do something. So this is also called as impairment. Is that clear? Then what is disability? So disability is lack of do ability to do something. So disability means the person may not be able to do a particular function because of the disease or because of his problem. Okay, so that is called as disability. Is that clear? So impairment is different, disability is different. Disability is restriction, or you can say the ability to do or perform the particular act is not there. Maybe this disability present from the birth, or it is coming because of any disease or anything. Okay, so it can be because of like from the birth, or it can come because of any disease or anything. Okay, so that is called disability. Handicapped is a disadvantage for a given individual that limits, or you can say the name we are giving to a particular person. So if a person is not able to walk because he is not having leg, then we call him as handicapped. Okay, so it is just a word that is used in the normal society to identify a particular person. But nowadays we are not supposed to use this word handicapped. Okay, so we use it as differently challenged or differently abled. Okay, so we should not use handicapped. We have to use the word called differently challenged or differently abled. Okay, so these are the terms that is used in rehabilitation. So now we will go into rehabilitation. So this WHO, when they thought that rehabilitation should be included in health system, so this was thought and implemented in 1980. So before that, we didn't have anything called rehabilitation. After 1980 only, we had this rehabilitation included in the health system. Okay, so at that time, they framed a particular terminology called International Classification of Impairments, Disability and Handicap. Okay, so they named as Impairment, Disability and Handicapped Classification. Okay, later after 2000, they just reduced or reframed the word. As I said, we should not call them as handicapped. So they just reframed the particular terminology as ICF. ICF means International Classification of Functioning, Disability and Health. Okay, so they just removed two words, impairment and handicapped, and they changed into functioning and health. So nowadays we are using this ICF classification only. So most of the countries use this ICF classification, and according to that, they give a framework for disability, and they give an evaluation for disability, and they work on that. Okay, so this is nothing but WHO has just given a framework for all the countries to have a particular have a classification and use the classification for deciding something. Deciding, maybe you can decide the financial support, maybe you can decide how much impairment he has. Like it can be like you can, according to the classification, they can classify and give a particular percentage to that particular person, so that he can get the financial support, he can get the societal support. So this classification mainly focus on three things. One is it focus on body function, it focus on body structure, then whether the person has any additional problem or severity. Okay, additional information on severity and environmental factor. Then third is the activity they are able to perform, or the activity they are able to not they are not able to perform. Okay, so this ICF is basically classified according to the three things. One is body function and structure. So body function and structure means whether physically the person has all the features and all the functions. For example, if a human being means we need to have two hands, two legs, isn't it? Two eyes, two ears, like that. So whether they are having all those structures and whether all those structures are functioning. Okay, so that is the first part of classification. Second part is what is the severity of their problem. Sometimes the severity may be increased because of the environmental factors. So all those aspects will come in the second level. Third is the activities they are able to perform or they are able to get involved. So that is the third part. So you have three parts here: body function and structure, then additional severity or environmental factor. Third is the activity they are able to do. Okay. So this ICF, International Classification of Function, will be covering all these aspects. One is activity of the person, then participational level of the particular person, body structure, body functional affected, personal factors, health condition, activity limited, functional limitations, environmental factor, and participation restriction. Okay, so we will see all these aspects later when we are seeing about the disability evaluation. Okay, so that's why now we are generally seeing what are the aspects it is covering. Literally later in the evaluation chapter, we will see little more about this covering. Okay, so by getting all these informations, that is by getting the informations about the activity of a person, participation of the person, or body function, structure of the particular person. So after getting all these details, they will be classifying the persons into this category. So one is mobility and physical impairment category, one is spinal cord disability category, other one is head injury and brain disability, vision disability, hearing disability, cognitive and learning disability, psychological disorder, then invisible disabilities. Okay, so by checking all these aspects, the WHO has helped us to classify the deformity or classify the disability person into this 8 classification. Is that clear? So if any person is not able to do certain function, then according to the classification, we will bring them to a certain any one of this classification. Okay. So now we will see this is what like WHO has done. Whether Malaysia is following WHO, yes, Malaysia is also following WHO classifications only. And like Malaysian government has formed a department for them that is called as Department of Social Welfare. So this Department of Social Welfare has divisions under them or sub departments under them, those who take care of the disability persons. Is that clear? So that particular department is called PWD. PWD means persons with disabilities. So each country will have different names. Okay, so in Malaysia, this disability peoples will be taken care by Department of Social Welfare, and this was in the social welfare they have a sub classification called persons with disability. Okay, so PWD. So does Malaysia has more number of disability persons? Of course, Malaysia has more number of disability persons. So till 2017, Malaysia had nearly 450,000 disability persons registered under them. So why do we need to register under this? If we are registering under this particular sector, then the government will be able to take care of the disability persons and take care of the of each aspects. Okay, and they will be having job prospect for these people. They will be having financial support for these people. They will be having lot of other monetary benefits and job benefits. Maybe during the pandemic, they have to check this particular people separately. They have to give lot of support to this particular person separately. Okay, so that's why we need to register this disability people under the particular sectors. And how do they register? They do the classification according to the WHO. They give certain evaluation for the disability people and they register under them. So about the evaluation part, we will see it in detail in the later classes. Okay, so according to like in Malaysia, if you see, this is the rough classification, rough strategy, or you can say rough statistics of the disability people. So we have more number of disability people, more number of physically disabled person. Okay, so we have more number of people who are physically disabled. Maybe people who are in wheelchair, people who are in brace, prosthetists, people who are using walking aids, people who are using like different of physical problem. So those are around 35% of people. And near to that, you have something called learning disability. So you have to see this nowadays, this learning disability is keep on increasing. So learning disability comes under cognitive aspect. Okay, so in Malaysia, yes, we have cognitive problem, or you can say the cognitive problem is equal to the physical problem. So nearly 34.8% of people have this learning disability. So of course the numbers will be little higher also, because not everybody go and register, right? So there may be some change, some increase or decrease in the numbers. Then there are people who are having hearing problem. There are people who have mobility problem, who have speech problem, hearing problem, or who has the mental or psychological issues, or people with multi-disability also will are there. Okay, so these are the this is a rough calculation for you to get an idea. Sometimes we may think why we are learning this subject, but like we have to uh, uh, we have to see that in Malaysia this disability population is also keep on increasing. So there is the need of rehabilitation is very higher in Malaysia. Then these are the major people who will be taking care, or who will be the stakeholders of the healthcare system. One is the government, the public, the NGOs, or you can say non-governmental organization, then health insurance companies, hospital administrators and governing bodies, healthcare providers. So all these people are stakeholders of the healthcare system, who will be taking care of this rehabilitation also. So especially this disability, like other than the government and the public sectors, like NGOs play a major role. So especially NGOs will be helping the particular family or particular person to get a job or get any of help, monetary benefits or anything. So that is the work of the NGOs. Okay, so all the like there are a lot of NGOs in Malaysia who will be taking care of this. So you can see like this is a psychological aspect, Mind Malaysian Information Network. This is OKU job portal where the disabilities can look for the jobs. Then you have Disability Association. So like this is just a little bit, but like you have more and more of NGOs in Malaysia who are working under this. Now, so you have seen the different aspects of rehabilitation. So and you don't think that only physiotherapists have to do this rehabilitation. It is not like that. So rehabilitation is a teamwork. It cannot be done by a single person. Okay, so it has to be done in a team, and it is a multidisciplinary team approach where everybody have a equal role, or everybody uh, will have a major role to play with. Okay, so these are the team members. One is the family, patient and the family. Okay, so patient also need to be cooperative. Otherwise, you will not be able to treat the particular person, or they will not understand. Okay, so they have the patient also have to understand your concept, and they have to cooperate. Otherwise, you cannot improve anything in the particular person. Then the family members. So the family member is more important. So whenever you give them any training or anything, the family member is the one who has to accept and bring the patient to you. So they are very more important. Then psychiatrist, who will be taking care of the psychological aspect. rehabilitation nurse, social worker, physiotherapist, occupational therapist, speech and language pathologist, psychiatrist, psychologist, psychologist, recreation therapist, audiologist, dietitians, vocational therapist, orthotist, prosthetist, respiratory therapist, then chaplain, then case manager. So uh, all of them will be having a team, will be forming as a team, and they will be taking care of the people. But here, so this all rehabilitation team members will be there in the will be there in the particular sector. Okay, and as a rehabilitation team member, whenever a patient comes, this team member will be forming a smaller team. So for example, if a person who's having a speech problem is coming to you, then you will be including the speech therapist. Okay, so if there is no need of physiotherapist, then they don't include you. Okay, so it doesn't mean that all the team members will be getting involved in with all the patient. It is not like that. Okay, so it is not mandatory also. So wherever is they just pick up the members whosoever is needed for that particular patient. So according to the patient, they will be getting involved in the team members. So of course, we will be seeing what are the works or roles of this team members in detail in the next class. Since it is 1 hour class, we will not be able to complete that. But that is a next topic. So what is the major role of each and every member? Okay. The next is what these team members will do. So this team members will be planning the care of the patient, or they will be having the complete plan of the patient. Each team member will be assessing the patient individually. Then they will be coming out with a plan of the treatment. Then all the members will sit together and discuss about the particular patient. Then after discussing, this complete team will be planning about the long term and short term goals. So long term, short term, what we have to do now. As a long term, what is our goal? So this all, everything is not decided by a single person. It is decided in the complete team. Why? Because, for example, a neuro patient is there, and the person's upper limb or lower limb is affected. So as a physiotherapist, I will be planning something, and I will see, okay, we need to improve the lower limb first. So I will be concentrating in the lower limb. But some other person will come, and he will be thinking that you like, if the physiotherapist improves the upper limb, then I'll be able to give this, like that. So if they don't communicate, they will not be able to bring out the person. So that's why here they make a small team, they talk with each other, then they set a goal. So every team member will be working towards that particular goal. Okay, so if each and every one are working in a different direction, then we will not be able to achieve the goal. So that's why we need to, they will be sitting together and preparing the short term and long term goal. Then they will be educating to the particular patient and the family members according to the need. So physiotherapist will do the physiotherapy part, then occupational therapist will do the occupational part, like that. So everybody will be educating the person according to their role. Then again they will meet together and see what is the patient progress. Then again they will be thinking about how we can they can how long the person need to stay in the hospital, or how long, or how to proceed. All those things they will sit and discuss. Then they will discharge the patient. So once they discharge, they will not just leave it like that. So they will be giving the person to a community rehabilitation people or center, where though they will be taking care of the person after the discharge till he's able to get back to his normal life or get back to his near normal life. So the complete plan will just go like a team. It doesn't have any individual aspect at all. Everything will be going in a team. Is that clear? Next. So what is rehabilitation setting? So rehabilitation setting is like we will be having a uh, uh, we will be having an acute setup, then we will be having a follow-up setup, then we will be having a longer term rehabilitation setup. So acute setup means where the patient immediately after the disease or immediately after the injury, the patient will be coming to the center, he will be getting treatment of the center, then he will get discharged. So this is called acute setup, where the immediately after the fall or after the problem they will be coming and meeting the person. Then after getting discharged there will be a follow-up rehabilitation team. They will be following up with the patient, they will be helping them to get the needed things, like for example a person has met with an accident and he has broke his lower leg. So immediately when he is coming to the hospital, they will check, take X-ray, they will see what, like where it is fractured, whether they need a surgery or a non-surgical procedure. Then if they don't need any non-surgical procedure, they will put a POP plaster and then they will ask the person to go home. That is called acute setup. But so after the POP, whether the patient will be able to walk back to home, he cannot walk back to home. So they will be making them to sit in a wheelchair and they will just send the patient. But after that, so whether the person will be able to be in wheelchair for till the fracture is healing, whether the patient will be able to be in the wheelchair for long time, cannot, because he has to get up, walk to the bathroom, or use the like he has to do his day-to-day life activity, right? So there only this follow-up medical rehabilitation team will be coming under, where we like physiotherapists, occupation therapists will be coming under the role. So our workers, after the patient is after the POP of the patient, we have to bring the patient to the physiotherapy center. We will assess the person, then we will give them the gait training. So we teach them. So if we are giving them an elbow crutch, we teach them how to use the elbow crutch. If the person need to be in the wheelchair, then we teach them how to be in the wheelchair, how to move from the wheelchair to the bed. The person obviously cannot sleep in the wheelchair itself. He has to move to the bed. So you need to teach them how to move to the bed. Then you need to teach them how to move from the bed to the wheelchair, bed to the toilet, bed to toilet to the bed, like that. So all these things will be taken care of the follow-up medical rehabilitation. Okay, then afterwards, longer term. So if the person is a schoolboy, so how he will go to the school, whether he is able to go to school. If he is able to go to school, whether the school will be allowing him to come in the wheelchair, or he has to lose some 8 weeks or 6 weeks of classes. That clear. So all these longer term rehabilitation is taken care within the community. So that is called as community rehabilitation. Is that clear? So this is the rehabilitation setup. So we have the acute setup, we have a follow-up setup, then we have a long-term rehabilitation setup. Okay. So we'll see what are the barriers of this rehabilitation. One is lack of strategic planning. So if the rehabilitation team doesn't have a planning properly, then they will not be able to run. Each and everybody will be taking care of different aspects. So they will not be able to uh, plan and go towards a certain rule. Okay, so which is very important. Then lack of resources or health infrastructure. So they need a health infrastructure. So for example, if you are in the follow-up medical team, you need to have wheelchair, you need to have wheelchair, you need to have walking aid and other things. So if you don't have, then no use to bring the patient, isn't it? So this is very important. So they need to have the resources, they need to have the infrastructure. Then lack of agency responsible to administrate, coordinate, and monitor. So in the community setup, you need to have people who will be able to monitor the complete longer term plans. So that will be monitored by the agency. Inadequate health information system and communication strategies, complex referring system, absent of engagement with people with disability. So these are the barriers. So one is they don't plan properly. Another one is they lack in the resources and infrastructure. Third is they don't coordinate properly with the community agencies. Fourth one is if they miscommunicate with each other, then also they will not be able to rehabilitate properly. Then there is a complex referral system. So nobody will just come and see the patient. You need to refer to the team members properly. If you don't refer to the team members properly, then they don't improve. Okay, so for example, in the rehabilitation, during the rehabilitation, suddenly the particular person has some chest complication. So you need to refer the person to a respiratory physiotherapist. Then only they will see, they will teach them how to cough, how to bring out the secretion. If they don't give the referral, then the patient might die with chest complications. Okay, so these are the important aspects uh, that will be act as a barrier for rehabilitation. Then at last, if you don't speak to the particular persons properly, disabled persons properly, then also it will like there will be a barrier. Okay, so how to address this barrier? So I think it is already 4 o'clock. Can I take for 5 more minutes or I'll stop here?